Ruchi Kapoor, clinical assistant professor of medicine at the University of Washington and cardiology faculty at the UW Heart Institute. Today, we'll be talking about food for heart, and I will let her discuss that in much more detail here. In terms of logistics, if you do want to ask any questions during the presentation, please feel free by typing into the Q&A or in the chat box. You can in the Q&A do so anonymously if you prefer. At the end of the presentation, we'll also have a survey that if you can take the time to please fill out in terms of what you may have learned today. So again, thank you so much, Dr. Ruchi Kapoor. Please take it away.
Thank you so much, John Michael, for that introduction. I'm so excited to talk about this topic because it's kind of near and dear to my heart. Well, I like food and I really do like the heart. So the main thing I wanted to kind of preface before going forward is that a lot of this information is available through the American Heart Institute, through the American Heart Association, where I work directly with the local chapter. I'm on their board, I'm the president, and it's just a wonderful resource for people who want to learn about diet and nutrition and how to go about being heart healthy. And I'll have some additional resources at the end. So the main question that I wanted to start with is, first of all, what is heart disease? Before we get to the topic of food for the heart, let's talk about the thing that we're trying to prevent. And heart disease is basically blockages in the arteries, the coronary arteries that supply blood to the heart muscle. You can see that a lot of these blood vessels wrap around where the heart muscle would be. And this is an angiogram procedure where we go in, typically through the artery in the wrist or in the groin. We go all the way up through the aorta to the heart, and we inject contrast dye directly into an artery to look for any blockages that we can potentially open up if it is causing a problem. Sometimes we can get diffuse atherosclerosis, meaning plaque buildup in the arteries where there's a lot of generalized and gradual narrowing, versus you can get obstructive atherosclerosis, which is a very focal blockage, a really tight blockage in one spot. Either way, both of these can cause symptoms. And by symptoms, I mean chest pain, tightness, pressure. But for some people, it may be something more gradual, like getting short of breath or winded with walking, can't do as much exercise as you're normally able to do. And diffuse atherosclerosis, we more often see that in younger women. The obstructive atherosclerosis, we see that more typically in men and older women. The idea here, of course, is that these plaques, these blockages that have built up can rupture, can break, and cause a complete occlusion, complete blockage of the artery, in which case we call it a major heart attack. If something like this happens in a brain where we get blockage in the artery of the brain, we call that a stroke. And collectively, those two types of blockages in the arteries of the heart or arteries of the brain is what we collectively term cardiovascular disease. And the whole aim of my talk is going to talk about the risk of cardiovascular disease, these blockages, and how do we prevent it through diet and nutrition and food that we put in our bodies. The reason this is, of course, so important is because cardiovascular disease is the #1 killer in the United States. This data is a little bit old, 2019, and I think they just came out with more recent updated numbers. I don't have those, but cardiovascular disease, a lot of people find it surprising, kills more people than the cancer, all cancers combined. That's true for women, that's true for men. So very important topic and very important thing that we want to address. These are some of the more common risk factors for people developing heart disease or cardiovascular disease in general. The #1, of course, being smoking history. If you have health issues like high blood pressure, diabetes, cholesterol, all of those that require sometimes medications to manage those. But then we get into diet, the topic of the day, physical activity, alcohol consumption, up to a certain point may be considered beneficial for the heart, but beyond a certain point is a toxin to the heart and can be very harmful. Psychosocial stressors in life, and obesity, waist to hip ratio, family history, certainly people who have parents, uncles, aunts, grandparents, brothers, sisters who've died of heart attacks or strokes, are at much higher risk of developing cardiovascular disease themselves. Certain autoimmune conditions, not very often talked about, but tends to affect women more often. Older age, older people are more likely to get cardiovascular disease than younger people, and certain exposures over your life. So for example, a lot of women who've had breast cancer and get radiation therapy for it are at risk of developing heart disease down the road. Certain veterans who've received Agent Orange exposure, for example, certain chemotherapies, those kind of medications also increase risk of cardiovascular disease down the road. But ultimately, the question that what is important to ask is, what can you as an individual change? Certainly aging, haven't found that fountain of youth yet, so not a reversible, not a controllable risk factor. Family history, genetics are kind of what you're born with, but looking at this list of risk factors, there's a lot of these that you have some control over, that you can have a positive impact on your own risk of reducing heart attack or stroke in the future. And I put a little asterisk by obesity and waist to hip ratio, partly because there's some debate on whether it truly is a controllable risk factor or not. And a lot of it is tied to kind of the body image issues and psychosocial issues related to obesity and how we portray obesity and dieting around that. So somewhat controllable, but some would argue that it's not really. So adopting better dietary habits will actually impact your risk for hypertension, diabetes, cholesterol, all of that also. So you get 2 for 1, or I guess 4 for 1 in some ways. And adopting better dietary habits, consuming the right amounts of proper foods, may be the single most important thing that you can do to lower your risk of cardiovascular disease. I wanted to start out, before getting into the details of what kinds of foods you should eat and avoid, I just want to talk about portions. And a lot of people get confused about what is a portion size versus a serving size. And portion is 100% within our control. That is how much we choose to eat in one sitting when we sit down at the table. And a serving size is what the amount of food is listed on a nutrition label. And the two are quite frequently different. So for example, here we have a wonderful healthy bran muffin. The package will say that 1 serving is half of a muffin. So each package actually contains 2 servings. When you're taking this muffin and putting it in your mouth, you're going to eat the entire muffin. And if you do, that's your 1 whole portion size, but that 1 portion size actually contained 2 servings. So very important to distinguish that. The reason being that portion sizes have actually grown dramatically over the last 40 years. And the average adult today consumes 300 more calories per day than they did back in 1985. And the other reason this is important is because Americans now eat out far more often than they used to. And so the portion that you're getting at the dining table in a restaurant is also much bigger. And you don't get as much control over what you get there, but you still get control over what you put in your mouth. So don't be fooled by the portion size at restaurants. And so I wanted to do a little quiz here. I'm not sure if John Michael were set up to do this, but basically I wanted to get your input on, here's some pictures. Here's some single servings of fish, meat, cheese, bagel, baked potato, and fruit. And I wanted to see if anybody is able to help me match up the picture to what we think is a single serving of a fish or a meat would be.
And if we do not have the poll actually set up this way, what we can do is, if you do want to chat what your answer is, we can complete it that way.
Zero meat is the best. Yes, thank you. Zero serving of meat, spoken for somebody who I'm guessing does a lot of plant-based diet. So a single serving of fish or meat is actually about the size of a deck of cards, which if you think about it is really not that much, but that's what a single serving is about 3 ounces of meat or 3 ounces of fish. And then a single serving of cheese is about 1 to 2 ounces of cheese, and that's about the size of a domino or 3 dice. Single serving of bagel. I had to really search hard to find a picture of a hockey puck to make sure that it really reflected what a bagel would look like. And then a single serving of baked potato is, yeah, half a bagel per serving is correct. And then a single serving of baked potato is about the size of a mouse. And a single serving of fruit is similar to the size of a baseball. So if you have 2 apples or 2 small-ish oranges, that's about 2 servings of fruit. Now, if you have a large, extra large apple, that's actually is 2 servings of fruit if it's bigger than a baseball. So what are the recommended serving sizes per day of the different food groups? This is what's formally recommended: 2.5 cups of vegetables, 2 servings of fruit, so 2 baseball-sized pieces of fruit, 6 servings of grains, 3 servings of dairy, about 5.5 ounces of protein, so 2 decks of cards of either fish or some kind of meat. But ideally, we also want to include, of course, plant-based foods, plant-based protein. And that means including some amount of nuts, seeds, beans, and lentils per week, and 6 to 8 ounces of oily fish like salmon. And then about 3 tablespoons of fats or oils. And we'll kind of talk about each of these subgroups a little bit separately. But to kind of wrap up the portion size part of the talk here, here's some very helpful tips that I've found on how to help limit the amount of food that you put in you. One is that when you're cooking for family at home and you're sitting at the dinner table, only serve what you think is what is a normal amount of 1 serving. And really don't put extra food out on the table and save the leftovers for another meal so that you're not tempted to increase your portion size more than the recommended amount of servings. When eating out, skip at appetizers. It really adds more calories and more food and more portion to your plate than you need. Share salads, share the meal. And then the other one, this is, I have to say, this is a personal win for me, or personally, it's actually rather hard for me, which is avoiding eating while watching TV or a movie. It's so natural to kind of go for that bucket of popcorn when you're sitting down at a movie. And it's really, but you're distracted, or I'm distracted anyway. And I find it really hard to pay attention to what I'm putting in my mouth. So I'm watching and I'm just shoving all that popcorn or whatever's in front of me in my mouth without really tasting it or paying attention to how much of that is actually going inside me. So if you avoid doing that, that's one really good way to limit portion size. And the last one here being for snacks, avoid eating directly out of the box or the bag. Really put some amount out in a plate or in a bowl and use that as your portion size. And that's how you would limit how much of a snack you put in yourself. Next, I kind of wanted to focus on talking about specific foods that can help or hurt the heart. We've all seen pyramid diagrams like this that have been going back several decades, where they put the foods that you should be eating more of on the bottom and the foods that really should be rare treats on the top. So they really compose a very small amount of your total meal. The data on all of these individually have been accumulating over several years worth of research. And what we find is that people who have more whole grains, nuts, vegetables, fruits have lower risk of heart disease. Certainly dairy is a little bit of mixed bag of information on whether it helps lower risk of heart disease or causes higher risk of heart disease. Fish also has been shown to lower risk of heart disease, but certain fish more than others. Refined grains, so your typical white bread or pasta or white rice, they are also a mixed bag, but really erring more on the side of they cause higher, they lead to higher risk of heart disease. And then finally, also processed meats. Processed meats is going to be something that we're going to keep coming back to throughout the talk as to how much they really contribute to increased risk of heart disease. Here, the increased risk by more than 42% in this particular meta-analysis. All of this kind of looking at individual subgroups of foods led to one of our most important trials that we have looking at diet and its impact on heart disease. Mediterranean diet, meaning foods that are consumed by people who live around the Mediterranean Sea. But this particular study, the PREDIMED study, was done in Spain, where they looked at almost 7,500 people who had high risk of cardiovascular disease. For example, they had diabetes or had family history, but they did not have any cardiovascular disease at baseline. And these more than 7,000 people were put on either a low-fat diet or a Mediterranean diet with, they were given a supplement of olive oil or they were given a supplement of nuts. And they followed these people for almost full 5 years. And these are some of, if you're wondering exactly what constitutes a Mediterranean diet, here I kind of put some of that information directly from the paper. So here we look at fresh fruits, more than 3 servings a day, vegetables, more than 2 servings a day, fish, especially fatty fish, seafood, more than 3 servings a week, really focusing on legumes, white meat, white wine is optional. Olive oil and tree nuts, as I already mentioned, these are 2 separate branches in the study, and really discouraging red meat, discouraging baked goods, soda drinks, anything like that. And comparing that against what used to be our traditional low-fat diet, which low-fat diet really said, low-fat dairy, but go ahead and eat your bread, potatoes, pasta, rice. Similar recommendations regarding fresh fruits and vegetables, and lean fish and seafood, but not making any specific emphasis for olive oil or legumes, for example, and discouraging very similarly commercial baked goods, but then also discouraging nuts and fried snacks because they have high fat content, avoiding fatty fish, and avoiding some other spreads because they have high fat content. So the idea here being that here they're paying attention to the kind of fat that's being consumed by people. So if you've heard of polyunsaturated versus saturated fat, really emphasizing that people have more of the unsaturated fats and really discouraging saturated fats that we find in more of the red meats and the spreads. And this was a phenomenal result here, where we see that people who were following the Mediterranean diet compared to the low-fat diet actually had lower incidence of heart attacks, strokes, or death from cardiovascular causes. Majority of this benefit was actually in strokes. people who follow the Mediterranean diet, regardless of whether it was supplemented by nuts or olive oil, they tended to have lower risk of stroke compared to people who were just on a low-fat diet. But this reduction was almost 40%. So this was a huge gain that we found people can have if they really focused on incorporating more of the polyunsaturated fats that you get from nuts and fatty fish. So I wanted to take a little bit of a break, given that information, to see, you know, if you're presented, you're out at a grocery store and you're like, I need some fruit for my kids. Are you going to go to the fresh produce section and pick up some oranges? Or are you going to go to the juice section, pick up an orange juice? If you had to pick between the two, which one would you pick? We're not at the other ones just yet. We're just at the orange section. Don't be shy. This is completely anonymous. Give it another like 10 seconds. Okay. So if you picked orange, you're correct. Does anybody know why? I don't know if anybody wants to participate in the chat. Yeah, exactly. Thank you. Thank you for participating in the chat. It is because whole fruit actually includes more fiber than juices. Typically the juice, you're kind of losing a big part of the nutritious aspect of a fresh fruit. Other substitutes, because a lot of places fresh produce is not affordable or not accessible, in which case frozen fruits, dried fruits, freeze-dried fruits, those are good substitutes for fresh fruit also. And yes, absolutely. We didn't really talk about added sugar, but a lot of the fruit juices that you see in that fruit juice aisle have added sugar to them, and that has its own terrible risks of cardiovascular disease. So one more, if we can talk about the bread, if I can have people participate in the bread question, and then we'll have one more question after this, and we'll take a little bit of break from answering questions. Yeah. B. Oh, I like this way of answering questions better. So a lot of people have voted B because in A, what you clearly see is white bread, and in B, you see whole grain bread. The difference between the two types of breads is that the white grained foods basically only contain the endosperm portion of a grain, but a whole grain includes all of the grain particle. And that includes bran and the germ portion, and as a result has more fiber, it's more nutritious. Another way to think about it, which a lot of people who have diabetes or are familiar with diabetics, is glycemic index, which reflects, you know, when you take this piece of bread and put it in your mouth and your body, how quickly is it going to get absorbed in your bloodstream, and how quickly is your sugar going to spike. With white breads, the simple sugars are going to spike a lot more quickly. And with brown whole grain breads and brown breads, they tend to rise more gradually and are better overall for diabetic health amongst other types of health. And the last one here is making choices. On the left, we have a fish, and on the B, we have delicious sizzling bacon. I'm seeing some votes for A. Yeah. Yeah. Thank you for for answering questions via chat. I really appreciate audience participation. So this is pretty important, right? Because this is, I've already emphasized this as part of the Mediterranean diet. What we saw is that diets that emphasize fatty fish like salmon, that include more polyunsaturated fats, are better for your heart health. They reduce risk of strokes, they reduce risk of heart attacks in the future. Bacon is problematic twofold. One is that it has more saturated fat compared to the polyunsaturated fats that are heart healthy in and it's a processed form of a meat. It's gone through additives to it, and as we've already kind of talked about, processed foods are not that great for cardiovascular health either. So ultimately, the question that I always end up asking my patients every single time is, what's your source of protein? What's your preferred source of protein? And people don't realize that there are surprisingly large amount of plant-based proteins and plant-based foods that have high protein content. And how you get it, whether you incorporate some of these protein choices into your meal plan, makes a big difference. And we have lots of trials that have shown this and include just a little bit of the data here. One is this study from a long time ago, actually, 2014, which I guess it was less than 10 years ago. But this was actually the same Predimed study, the Mediterranean diet study, but looking at a subgroup of people there, where they looked at how many, what portion of their diet was essentially pro-vegetarian, and dividing that, how much of the pro-vegetarian food pattern that they had, dividing them into fifths, and looking at people who had the most amount of plant-based food versus the least amount of plant-based food. What we find is that the people who had the most amount of plant-based food had lower risk of death. Just simple. Higher consumption of plant-based protein led to lower risk of dying. They looked at it, not the Predimed folks themselves, but another study looked at what if you substitute for animal protein, and different kind of animal proteins are listed here, for plant-based protein. So for example, if you put dairy instead of plant-based protein, you actually have increased risk of dying. Same thing with egg, fish, poultry, unprocessed red meat, and of course the biggest culprit here was processed red meat. If you do 3% of your caloric intake was instead of being plant-based was processed red meat, your risk of dying increased by 45%. If we looked at specifically cardiovascular disease, again, plant-based protein is better for you. If we look at cancer, the results are a little bit more equivocal, but again, processed red meat ends up being a big, big problem every single time, with every single just risk of dying, risk of cardiovascular disease, risk of cancer, risk of other ways of dying. All of these, the processed red meats, when you substitute that for a plant-based protein, you're harming yourself every single time. And which brings us to the question of what is processed foods, and are all processed foods bad? Processing basically means that we're changing the food from the time that you, fruit or a vegetable, from the time that you pick it off a plant, or a meat from the time that you get the meat, how you change it, prepare it, package it in some way for our consumption that's changed and altered. So a lot of that we're familiar with: freezing, canning, roasting, but sometimes we also have additives to the foods that help them last a little bit longer on our shelves. Very important for people who don't have access to fresh produce. How do we make the food get to them and last a little bit longer? Sometimes these additives are actually fortifications to add nutrition. So iodine to our salt, for example, or calcium, vitamin D, extra fiber to some cereals. All of them add extra nutrition to the meal. So not all processed foods are bad, but highly ultra processed foods, which is a category in itself, is where we have extra sweeteners and oils and extra sodium salt added to the food to either make it taste better or to make it last a little bit longer. And unfortunately, it's these foods that have been associated with increased risk of death and worse cardiovascular outcomes. And even natural or organic foods that you look on the shelf, they really try to really upsell themselves. They can be very highly processed. It's kind of funny in some ways. A lot of my patients, surprisingly, or maybe not so surprisingly, I ask them about their diet, and I ask them a fairly open-ended question of, what kind of food do you eat? And they tell me, oh, I eat very healthy. Well, what does that mean? Oh, it means that I eat all organic beef or all organic bacon or all organic or, free range chicken, but I eat, fried chicken. So just because something is organic or natural doesn't necessarily mean that it's a healthy food option. And same thing, even if it's natural or organic, it can still be highly processed. So what is a person to do? How do you sort through all of that? By reading and comparing nutrition labels. And this is an absolutely necessary skill to being able to follow a healthy diet. Anytime you buy a food off or pick up a food or a package or a box off the shelf, look at the nutrition label. It just gives you more or gives you more awareness. And as somebody made a point, buy things that don't have a label. That would be preferred, but sometimes that's just not possible for people, right? And I realize that there's a lot of working parents out there who are caregivers for a lot of other people and don't have that access to fresh fruits and vegetables or to prepare them. So sometimes it is necessary, and that's totally understandable. But if you do go to pick foods off the shelves or packages or boxes off the shelves, pay really close attention to what the nutrition label says, right? So the first thing is look at the serving information. We already talked about the difference between a portion size and a serving size. Look at the serving size. So I'm going to guess, just based on, I don't know what exactly this nutrition label is off, but I'm going to guess it's off a cereal box, because look at it. Serving size is this really odd 2/3 cup. Most of us, when we're putting cereal in our bowls, we're not measuring it exactly, but if you do, you're going to ballpark about a cup of cereal in your bowl. Well, that's more than what the suggested serving size is. So being very, very careful about what serving size actually is. And then you look at, okay, has 230 calories, and how much of those calories are coming from fat? And then when you do look at fat, look at saturated fat and trans fat, because those are particular culprits for causing increased risk of heart disease. Cholesterol, a lot of our cholesterol comes from animal-based proteins or animal-based foods. So being cognizant of that. The benefit to getting a box or a pre-prepared meal is that it tells you right on the box how much sodium is in there, right? So you can tell when we tell somebody, hey, we're recommending that you don't have more than 1,500 milligrams of sodium a day. Well, it tells you right there that if you take one serving of this cereal, you're going to get 160 milligrams. It actually makes it a little bit easier to track than if you just take a salt container and kind of shake it over your pot of soup. And then looking at the carbohydrates, total carbohydrates, but the wonderful additional piece of information that we have these days is knowing how much added sugars there are that are not a part of the food already. So if you, for example, we were talking about the bottle of orange juice earlier, how much sugar is there from the fruit versus how much sugar they poured in to make it more palatable to kids and more addictive in some ways to the kids. And then finally, looking at protein content and looking at some of the other beneficial nutrients like vitamin D, fiber, iron, etc. So the reading of a nutrition label does not stop at calories and does not stop at carbohydrates. There are only 2 pieces of information in the entire label. And I really, really encourage all of you to pay attention to every single component. And when you're comparing, certain, one loaf of bread against the other, really compare the 2 together. So somebody asked a question of what does a 20% on added sugars mean exactly? It means it's a percentage of your daily value. So assuming that somebody should be having 2,000 kilocalories of foods, of 2,000 calories a day of kilocalories of food a day, how much of that percentage should be sugar, and how much of that percentage you're getting from just this one serving. So of the total amount of sugar that you should be getting in a day, 20% of that is coming from this, just this presumed cereal, 2/3 cup of a cereal. Okay. So one additional, yeah, somebody, sorry, I'm also going to read out comments from the chat box. Is somebody made thank you for making this point and this comment, that a lot of our plant-based meat substitutes have really horrific nutrition labels. It's not that the labels are horrible, it's that they are ridiculously full of saturated fat. So just because it's plant-based, going back to the comment I made earlier, that a lot of organic or natural foods or plant-based foods doesn't always mean that it's healthier if it's processed. So a lot of the burgers that are out on the market, trust me, I've tried them, they're delicious. They're delicious because they have a ton of saturated fat and cholesterol. And in terms of, any health benefits, there's not much difference, I think, between, say, an Impossible Burger or a beef patty burger. That said, I think if you're trying to argue for an environmental benefit, that's a completely different argument. But if you're talking about cardiovascular health, I don't think you're going to get much of a gain. Look at next time you're in the burger aisle and you walk by these plant-based burgers. I'm not talking about the soy burgers or the black bean burgers. I'm really talking about these newer burgers that came out on the market that taste just like meat but are plant-based. Look at the nutrition label. I was shocked the first time I looked at one of them. So here's a couple of options for oil. This has been, of course, in the news quite a bit, but we have on one hand olive oil, and on the other hand, we have coconut oil. Both of these are plant-based oils. Which one would you prefer? Yep. So I got a few answers of A, olive oil. I set this one up by talking about the Mediterranean diet earlier, which did show giving olive oil to the participants really reduced their cardiovascular mortality. But the reason olive oils are wonderful is because of the unsaturated fats that are part of the oils. When you have plant-based or animal-based oils that have a lot of saturated or trans fats, then that's when your heart really starts getting into trouble. So unfortunately, coconut oil or palm oil, which we kind of lump together and call them as tropical oils, we do recommend avoiding those in favor of more of olive oils. Do I consider it healthy to eat any processed oil, including olive oil? No. And I think, but ultimately, it's always going to be a question of, or answer of moderation. meaning that, if you're going to fry everything in olive oil, that's not going to be the way to go for your heart health. But for example, if you lightly spray something on and then air fry it, which is a wonderful new tool, big fan. That's a great way to use a little bit of oil and still get that crunchy sort of fried texture without compromising your heart health. You can air fry without oil. That is 100% correct. I'm just learning to explore all the ways that you can use an air fryer. It's such a great tool. And then I think this is going to be my last multiple choice answer. So you're thirsty, you're walking by the local bodega. I lived in New York for 9 years, so I like bodegas. What are you going to go for? B. Yeah. Water, straight up water, as much as you can take. Why? The reason is, do you know how much sugar is in your drink? Yeah. A lot of people don't. Again, look at the nutrition label. It'll tell you exactly on there how much one serving is and how much sugar is in each serving and how many of your calories you're getting from that sugar. So for example, Monster Energy drink, 13.5 teaspoons of sugar. Mountain Dew. So many people tell me, oh, I'm not drinking any caffeine. I'm just drinking Mountain Dew, not realizing that Mountain Dew is full of sugar. It's a mountain of sugar. Nantucket nectars, look at that. It's like almost like, nectar. It's fruit juice, but it's got a lot of added sugar. And we know that sugary drinks if you have one daily serving of a sweetened beverage, you're at 20% higher risk of developing diabetes. There was another study, some of these numbers are very astounding to me, that 71% of adults, so majority of adults in America, get 10% or more of their daily caloric intake from added sugar. And if you compare people who get 25% or more of their total calories from sugar versus people who get less than 10%, the people who are doing more than 20%, 25% of their calories from sugar are more than double the risk of dying from cardiovascular disease. I mean, the statistics I can keep telling you, but we very clearly know that added sugar into drinks is associated with increased risk of diabetes, cardiovascular death, heart disease, strokes, if not just dying from those things, but also dental issues. It's such a huge contributor to the obesity epidemic. And I think, when we talk about weight loss with a lot of people, this is maybe not an easy one to cut out, but certainly one step that can have a huge impact in weight loss, amongst other things. So the question comes up, looking at how do there's choices, of course, at the individual level, but how do we encourage those choices? And one of the more controversial topics has been sugar sweetened beverage tax. Does it actually work? And the reason this is a question that I think is particularly relevant to us is because on January 1st, 2018, City of Seattle passed a tax on drinks that have more than 20 kilocalories of sugar per 12 ounces. Basically a little bit less than 2 cents per ounce of sugary tax. And what we found is that, if you look at the total amount of sugar that somebody bought this is before the tax period. So if you look at the total amount of sugar that was sold, they looked at kind of the barcodes that were scanned in grocery stores. The number one item that constituted the most amount of sugar was soda that was going to be taxed after January 1st. And then, just standalone sugar, kind of those big 5-pound bags of sugar, for example. And then we get into candy, desserts, cookies, etc. But really, this was astounding to me how much sugary soda we were consuming in the city of Seattle. And what we find is they did this group, I'm sorry, I forgot to put a reference here, but this group did a study looking at an actual amount of sugar sold before and after tax, which is right here, January 2018. And they really compared Seattle to Portland, which is a similar demographics to us. And hooray, Seattle, in general, you consume less or you buy less sugar than Portland in general. But what we find is that, you're looking at sugar sold. This is pre-tax. The trends in the amount of sugar sold is pretty similar. And then this tax goes in place, and the amount of sugar that's sold in Seattle really dramatically decreases. And the difference between the two cities is much bigger than it was pre-tax. And this difference between the two really persists for a couple of years. And then when you look at the untaxed beverages, you don't see that decline or that difference between the two cities. So this is one of our kind of best examples that we have that implementing a tax does mean that we certainly buy less sugar. Now, in terms of long-term health on data on cardiovascular outcomes, that's to be seen. I also wanted to talk about salt because I just had this conversation with my last patient of the day about limiting salt in diet because it helps really lower blood pressure. And here was a DASH diet. DASH is similar to Mediterranean in the sense that it emphasizes fruits, vegetables, sorry about the misspelling, meant low fat, dairy, whole grains, poultry, fish, nuts. So really DASH is the cornerstone of DASH diet is all of these foods, but they added a sodium component to it where they looked at people who were given high sodium, medium sodium, or low sodium diet. And what they look at, this is systolic blood pressure, diastolic blood pressure. And certainly the minute you go from, your regular old diet to the DASH diet, your blood pressure drops. But then if you further lower the amount of salt that you consume, you have another dramatic decrease in your blood pressure. And that holds true for both systolic and diastolic. And a question came up whether ideally should we not consume any salt at all? No, that's not true. I think, if you look here, the low salt diets are the 1500 milligrams. And I think depends on what the salt is made of. This is sodium salt. We have data that shows potassium-based salts actually also help lower blood pressure. So there was a recent trial that came out that talked about if you substitute maybe 10% of I think it was 10% of your sodium salt with potassium salt, you actually made pretty substantial gains in blood pressure in terms of lowering it. So ultimately, the take-home message from this particular study and other studies similar is that reducing salt intake plus following a DASH diet or a Mediterranean diet really has a maximum benefit in lowering blood pressure. And, when they looked at subgroups, men versus women, certain ethnicities, different age groups, really everybody benefited from having a low salt intake. But the highest benefit was in people who had hypertension, who had high blood pressure. But even normotensive patients or people, meaning people who have normal blood pressure, even they benefited from having a low salt diet. Super important. I wanted to kind of not spend too much time talking about weight, but a little bit of time talking about weight, partly because it's so frequently related to body image. And I see this in my clinic again all the time. I ask when I'm talking to people about their cardiovascular health in general, kind of doing, hey, how can we optimize it? How can we lower your long-term risk? Let's talk about the foods that you're eating. What kind of foods are you eating or trying to avoid? And the number one answer that I get is, oh, I'm trying to limit my sugar because I'm trying to lose weight. It's so tied into concept of self and how you see yourself in comparison to how other people see you, our impressions of others around us, of what we consider to be the ideal body image, body shape, body size. So much of that is also determined by media. We know that obesity is correlated with increased risk of diabetes, increased risk of cardiovascular mortality and bad outcomes. But I also want to emphasize that weight management and control, not just loss, but managing weight is really a lifetime project. And I have a lot of people who swear by, for example, the keto diet, the low sugar diet, the low carb diet, but then they stock up on the unhealthy fats, and suddenly their cholesterol goes through the roof, but they've lost weight. Their diabetes is now wonderfully under control, except that now they're at much higher risk of dying from a heart attack in the next 5 years because of what happened to their cholesterol. So rapid short-term diets can work, but in the long term, they usually fail. So my advice is be mindful of your eating patterns and make small changes, small adjustments that you can really carry on for the rest of your life. Promote healthy eating habits, increase physical activity, move more, be more active, follow the Mediterranean diet or the DASH diet, but incorporate small changes into your daily life rather than completely upending your nutrition plan. And really thinking of food as not for emotional well-being, but really for fueling your exercise and fueling your energy levels rather than something that you just put in your body for the sake of putting in your body. It's a very complex topic, obesity is, but I did kind of want to leave it at that. And in the interest of time, I'm going to just skip over these 2 slides. I think somebody just asked about how are the DASH diet and the Mediterranean diet compared? How are they different? And it almost seems like you were, I promise I didn't plant you in the audience to bring this slide up. But really, this was a meta-analysis that was done in 2018 that looked at various DASH diet, Mediterranean diet, prudent diet, all of these other diets, comparing them against really the typical Western diet. And what we find is that, all of these diets, Medi diet or prudent diet, they really all tend to lower risk of heart disease by almost about 30-ish%. The DASH diet, a little bit less so, 20-ish%. But the idea here is that the DASH diet is, it tends to be a little bit more, I think, dairy-wise. It encourages more dairy, whereas the Mediterranean diet tends to really emphasize low-fat dairy. So emphasizing Mediterranean diet is more about emphasizing healthier fats, whereas the DASH diet doesn't really take that into account as much. Ultimately, I think if those are small nuanced points, and I don't expect anybody to really follow a exact diet plan like they did in the studies. I mean, in the Mediterranean diet study, the Predimed, they gave people olive oil, they gave people nuts. For the DASH diet, they actually provided all the food. So that's how they were able to control and really get data that we can make sense of. But in real day-to-day life, it's not possible. And I don't expect it to be possible for myself or for my patients. But I do expect us to make, when given 2 choices, really look at the nutrition label and make better, healthier food choices. But that is a gradual process. So 3 important questions that I really ask all my patients. How often do you eat out or get takeout? How much from scratch do you cook at home? How much of it is pre-made sauce or pre-made broth? or boxed foods or things like that. And then the third question I typically ask them is, what's your protein source? As we've seen that the answer to this last question can really impact your cardiovascular health. Certainly I do want to acknowledge that there's barriers to healthy food choices related to food security. And one of the wonderful things about the Seattle sugar sweetened beverage tax, the SBT, was that the funding that we get from that those tax dollars can actually is being actively applied to addressing food security, to really making sure we have adequate food supply in places that need it, that it's affordable, that it's acceptable, culturally acceptable, and really that it accommodates people's needs, accommodates people's hours, types of payments that are accepted, culturally relevant food items are offered. And that's what our tax dollars are doing in the city. And when they looked at kind of where the health food priority areas are, they looked at where are the lower income neighborhoods, where does it take a lot longer to get to healthy food choices, and where are the places where we have higher percentage of unhealthy food retailers, meaning fast food restaurants. And a lot of it lies along the Duwamish waterways. And so that's where a lot of the focus is of the Seattle city efforts in improving food access in those areas. And of course, I don't want to leave without talking about the impact, unfortunately, that COVID has had on all of us in terms of food availability and food benefits. And this is March of 2020. And this is the number of households receiving food assistance from the county. And there's, of course, this dramatic jump up that happened right as COVID pandemic hit. And that number has sort of gradually been declining. But even so, in December 2021, this was still higher. More people are requiring more food benefits and food access than were before the pandemic. So it's still a problem, and we're working on it. And then the last thing I wanted to, this is sort of the last slide, but really is, there's a few different approaches to looking at food for heart health. You can look at it in a pyramid way. You can look at it, here's my plate, how colorful is my plate, is the comparison way, comparing nutrition labels, emphasizing the ones that have more whole grains and polyunsaturated fats, and comparing that and avoiding the ones that have added sugars or are processed. Few different approaches that you can take to your diet and food plan for heart health. And then the last thing I wanted to leave people with were some of these additional resources that I found very helpful in putting these presentations together. Is very accessible infographics and information and data, and some of them also like really kind of get into the science of heart healthy foods, if that's your thing, but really very helpful resources. And last, I wanted to kind of leave this for John Michael, but happy to take questions also.
Thank you so much, Dr. Kapoor. Just wanted to let everybody know, so we do have one more presentation this week on high blood pressure. That'll be on Friday at 6 p.m. Pacific time. You can find all of this information and upcoming events. We'll have another one on atrial fibrillation on Monday, February 7th at 12 p.m. noon. We'll make sure that all of them are on demand and you'll be able to access them on our Facebook page, Instagram, and additional sources there. So keep an eye out for future events. And then lastly, the last slide, Dr. Kapoor.
Oh yeah, this one.
Yeah, perfect. And just wanted to highlight Dr. Kapoor is located at the Eastside Specialty Center in Bellevue. We also have campuses at the UW campus in North Seattle, South Lake Union, Edmonds, Mount Lake Terrace, and Renton. If you do and do not have a cardiologist currently and would like to see one, just wanted to let you know that where our locations are currently. And again, all of our information is available on our Facebook pages as well as on uwmedicine.org. Any final questions for Dr. Kapoor while you have her? She's here. But thank you again so much for the presentation, Dr. Kapoor.
Of course, my pleasure.
Well, it looks like you got it all. Fantastic
Good. I'm
work.
glad. Happy to, you're always welcome to reach out to me through the Heart Institute if there's any questions or concerns that come up. Thank you so much.